You have been prescribed an ACE inhibitor, and you likely have some questions. This educational video will help you understand what ACE inhibitors are, what they do, why you've been started on one, and how an ACE inhibitor will help you. We will also look at how this therapy is monitored. Since side effects are often of concern, you will learn how to recognize and deal with side effects should they occur. Also, you will learn if other medications or supplements can affect your ACE inhibitor. Finally, you will learn how and when to take your ACE inhibitor and what to do if you miss a dose. Let's get started. The full name for these medications is angiotensin-converting enzyme inhibitors, but this is usually shortened to ACE inhibitors. Angiotensin is a chemical produced by your body that causes blood vessels to tighten and become narrower. Normally, these narrowed blood vessels help to maintain blood pressure and fluid balance, but for some people, it can make it harder for their heart to pump blood around their body. ACE inhibitors block the production of angiotensin so that blood vessels relax and widen, allowing your blood to flow more easily. Some of the more common agents in this drug class are shown here. You may have noticed that if your medication ends in pril, then you are taking an ACE inhibitor. These are the common or generic names for ACE inhibitors. You may also know your medication by its brand name, shown here in brackets. If you are dependent upon fair pharmacare for income-based drug coverage, then it is important to know that only a few ACE inhibitors are fully covered. Speak to your prescriber, pharmacist, or social worker if you have concerns about medication costs. You may be taking an ACE inhibitor for one or more of the following reasons: to treat high blood pressure, to protect the kidneys if you have diabetes or kidney disease, for heart failure, or after a heart attack or stroke. Let's start with high blood pressure. Many people are often unaware that they have high blood pressure because there may not be any symptoms to begin with. However, high blood pressure is dangerous because this added pressure can damage your blood vessels and organs, putting you at risk for heart disease, stroke, diabetes, and kidney failure. ACE inhibitors open up blood vessels, lowering your blood pressure, which reduces your risk of developing these conditions. Some diabetic patients with kidney problems may also be helped by ACE inhibitors. A normal kidney filters well to prevent protein from leaking into the urine. Finding protein in the urine suggests that kidneys are in trouble. ACE inhibitors can decrease the amount of protein in the urine and slow the progression of certain types of kidney disease. Heart failure is a condition where the heart muscle is failing to pump enough blood to meet the body's needs, especially with exertion. Blood carries oxygen and other nutrients out to the body. Since heart failure reduces blood flow, less oxygen will be delivered to the tissues. This may leave you feeling tired or weak. Because ACE inhibitors' main action is to relax blood vessels, the heart has an easier time pushing the blood around the body, thereby improving blood flow. This can help prevent further loss of heart function and may improve symptoms like lack of energy. ACE inhibitors can help the heart to recover after an injury, such as a heart attack. ACE inhibitors can make it easier for your heart to pump, and this will protect your heart and allow it to get stronger. They are one of several medications that are used to help reduce the risk of having another heart attack. You may not notice significant improvements when you first begin taking this medication. It is important to know that when taken regularly, its protective role may prevent further hospital admissions and help you live longer with fewer symptoms. For these reasons, you might be prescribed this medication even if you do not have high blood pressure. Here are some guidelines on how to take this medication. Even if you feel well, take exactly as prescribed by your primary care provider. Your primary care provider could be your family doctor, nurse practitioner, a walk-in clinic physician, or other prescriber. Try to take your medication at about the same time each day. If you take it more often than once daily, try to space the doses evenly throughout the day. Most ACE inhibitors can be taken with or without meals. Captopril and perindopril are best taken on an empty stomach. This means 1 hour before or 2 hours after a meal. Never take extra medication or double up to make up for missed doses. If it is almost time for your next dose, just skip the missed dose and resume your regular schedule. Inform your care provider if you are planning for pregnancy or to breastfeed. Notify your care provider immediately if you become pregnant while taking an ACE inhibitor. You will likely need blood tests within 1 to 2 weeks after starting an ACE inhibitor, and periodically thereafter to monitor your potassium level, which may increase when you are taking this medication. The test may also check your kidneys, since some people may experience decreased kidney function when they are taking an ACE inhibitor. You can help by letting your care provider know if you are suddenly urinating significantly less, or if you have diarrhea or vomiting lasting more than 2 days. If you have high blood pressure, then consider purchasing a home blood pressure monitor or using the automated machine from your community pharmacy. You may be asked to keep a written record of your blood pressure results. Speak to your care provider about your target blood pressure goal. Most people do not experience side effects with ACE inhibitors. Here are some of the key effects to watch for. Let your healthcare professional know if you notice any of the following. Cough. A persistent dry cough or tickle in the throat may occur. It is not harmful, but can be annoying. This may improve with time. Contact your care provider if the cough worsens or if you find it to be quite bothersome. Dizziness or lightheadedness. This is mostly seen when changing position from lying or sitting to standing. To prevent this, try to get up slowly to give your blood vessels time to adjust. If you take your ACE inhibitor once daily, you may want to try taking it at bedtime to minimize daytime dizziness. Be aware that alcohol can make the dizziness worse. Tell your care provider if symptoms worsen or if you are dizzy all the time. Dizziness may also occur with low blood pressure. If so, be careful doing activities that could lower your blood pressure even further, such as drinking alcohol or using hot tubs, saunas, and hot showers. You should not plan on driving until you know how this medication will affect you. Rarely, ACE inhibitors can cause a very serious allergic-like reaction known as angioedema. If you notice swelling of your face, lips, tongue, trouble breathing, or difficulty swallowing, then stop taking the ACE inhibitor and seek urgent care right away or go to your nearest emergency department. Other side effects may occasionally occur. Ask your care provider or pharmacist if you are concerned. As with other medications, there could be important interactions with other products that your care provider should be aware of. Ask your pharmacist about using an ACE inhibitor with the following. Anti-inflammatories, such as aspirin, ibuprofen, or naproxen. These pain medications, often purchased over the counter, may affect kidney function, raise your blood pressure, or worsen heart failure. Note that 81 milligrams of aspirin is commonly prescribed with an ACE inhibitor. However, do not take any more than a low dose of aspirin unless otherwise directed by your care provider. Remember that ACE inhibitors can increase your potassium levels. Therefore, you should avoid salt substitutes for flavoring food, as they often contain excessive potassium. If you are taking a potassium supplement, then check with your care provider to see if it is still needed. Ask your community pharmacist before selecting cough and cold medicines. Some of these products may contain ingredients that could increase your blood pressure. You should also ask about herbal products, as some of these may also increase blood pressure. These would include licorice root or black licorice, ephedra, or ginseng. Your pharmacist can review your list of medications, alternative therapies, and health products for other interactions. This does not always mean that interacting drugs cannot be taken together. Rather, advise your care provider, as they may want to monitor therapy more closely and adjust doses accordingly. In summary, ACE inhibitors make it easier for your heart to pump, lower blood pressure, protect the heart, brain, and blood vessels, and protect the kidneys. ACE inhibitors might make you dizzy or lightheaded for the first few days, but this usually improves over time. Use care when going from lying to standing. If your dizziness does not get better, your care provider might need to change the type or amount of ACE inhibitor that you are taking. ACE inhibitors could cause a dry cough. Although irritating, it is not harmful. Your primary care provider can discuss other medication options for you. ACE inhibitors could increase the potassium level in your body. Do not take potassium supplements unless prescribed by your care provider. Be patient with your medication. For conditions like heart failure, it can take several weeks and sometimes months before you notice an improvement in your symptoms.